Thank you for joining me, Dr. Amir, here at Fortis Health for another insightful session on the topic of testosterone replacement therapy. If someone were to present with symptoms, remember testosterone deficiency syndrome is symptomology based. Okay, if someone presents with testosterone deficiency symptoms, so we said lethargy, tiredness, poor libido, poor erections, brain fog, inability to maintain muscle mass, increase in fat distribution around the truncal zone and like thereof, then we can look into investigating. Now, based on the British Society of Sexual Medicine and other guidelines like the EAU, the European Association of Urology, as well as the American Association of Andrology, they've all got very similar setups when it comes to investigation. So the tools we look at generally, specifically, are your testosterone levels. And if you look at them specifically, you're looking at a 2 blood tests over a 7 to 14 day period, which will then tell us if you're deficient of testosterone. Now, there are other blood tests that you look at, so there's quite a few blood tests, but if you're talking about testosterone as a parameter on its own, yes, you look at that level. Now, by certain laboratory standards, there's different levels they look at, but generally the rule is between 8 and 29 or 30, that's where your testosterone should live. Now, that's quite a massive margin of error, a massive margin when you look at testosterone. Obviously, anyone less than 8 on 2 occasions would be deemed testosterone deficiency. You also look at the free testosterone, which is basically your testosterone which is left over after it's mopped up by things like albumin, another protein that we can talk about thereafter, and SHBG, or sex hormone binding globulin. And these hormones, obviously, these particular proteins, when they're quite high, even though your test levels might be good, they mop up a lot of testosterone and leave behind only a small amount of free testosterone. So we look at that level as well, and that should be between 0.225 and 0.58 to 0.6 in certain pathology laboratories. They have got different parameters. Now, that's the first point. The second point is if you're more than 12, between 30, it's hard to say you're in need of testosterone unless you have a one-to-one discussion with the patient and you look at their symptoms, you look at all of the risks and the benefits of therapy, and you can talk to them about treatment. But that is a very small cohort, and they talk about it in the world of endocrinology, something known as androgen polymorphism. Now, that in itself is a massive topic, and we can talk about it on another occasion. Then you've got the bit in between, which is testosterone between 8 and 12, where you can say, you can treat them and say, well, your levels seem to be insufficient and your free testosterone levels are insufficient. So again, looking at you, we can look at treatment. Now, we have to be careful because there's other things that can be going on in someone's blood panel, biochemical, physiological zones that we've missed out. And a lot of clinics won't check this. We do a comprehensive test of everything. So we look at not only your full blood count, your kidney, your liver, your thyroid function, your vitamin D, vitamin B, all of the hormones, not only testosterone, look at prolactin, estrogen, progesterone, LH, FSH. These are the hormones that regulate testosterone, as well as things like SHBG, and obviously your PSA, that's an important marker. So there's quite a lot of blood tests that you should do generally when you're about to embark on the therapy or to investigate testosterone deficiency. But if you're talking strictly about are you testosterone deficient, regardless of the cause, because obviously you'll be investigating the cause as well, and you'll be looking at different types of testosterone deficiency. Again, we could be looking at that more in depth. You'll be looking at the parameters between 0 and 8. That's really deficient. 8 and 12, insufficient. 12 and above, technically normal, but there are a cohort within that group that could possibly be deemed to be benefited from testosterone therapy, but that is a small cohort, and we refer to them as patients who can present in such a way that they might have okay looking levels but very symptomatic. And when you give them a short treatment, obviously after you've mitigated risk and spoke about benefits and risk and gone through the whole host of changes in one's life, including like modulating their diabetes, making sure they've got a good health lifestyle and they've got a good dietary protocol, then there is that cohort that we can say, look, we can give you a short course of testosterone and after 2 or 3 months review your symptomology. But generally it's less than 8, very much deficient, 8 and 12, insufficient. So really you've got to be looking at other factors that could be impacting their test levels, and obviously more than 12, technically you're normal, but there is a cohort out there that can benefit after extensive conversation, dialogue, and guidance. Outside of that, obviously, one needs to make sure that all the other aspects of your life are corrected. So in the investigation, you look at things like diabetes, you look at things like your full blood count, your kidney, your liver, your thyroid, your vitamin D. We forget vitamin D is a really important blood test. People miss out quite a bit because it's not really a vitamin, it's a prohormone. That in itself is another FAQ we can look at in another discussion. But there's a lot more blood tests you have to look at comprehensively, and that we do investigate from the outset in our clinic.